Welcome to Origins, a new podcast from the Dermatology Digest that takes a look back at the development of key techniques and technologies in dermatology. In this episode, pioneer and innovator Dr. Mitchell Goldman, the founder and medical director of Cosmetic Laser Dermatology and the medical director of Platinum Dermatology Partners in San Diego, California, discusses the history and evolution of laser skin resurfacing.
The next story I'd like to tell is the development of the ultra-pulse CO2 laser and the procedure called laser resurfacing. So here in San Diego, as well as in a lot of the United States and worldwide, we have a really big problem with skin cancer and early forms of skin cancer. And one of the places in San Diego or in our patients that really is difficult to treat is the lip. When one gets cancer on the lip, it can spread, as we all know, pretty readily throughout the head and neck. And so the treatment of actinic cheilitis, especially back in the 80s, was fraught with complications. We could do topical treatments, but Dr. Fitzpatrick and I started to use the CO2 laser for the treatment of actinic cheilitis. Now, in the olden days, the CO2 laser was not a pulsed laser, but a laser that continued. It was a continuous wave laser, which meant that when you basically put your foot on the foot pedal, the laser would be shining and vaporizing, and you could only stop the laser when you took your foot off of the foot pedal. And in doing laser resurfacing of the lower lip, you could get a very excellent result, but the problem was it took almost a month of healing for the patients to come back to normal. So along with one of our associates, Dr. Javier Ruiz Esparza, who was a Mohs surgeon and a dermatopathologist, we set out to try to design a CO2 laser to do what's called flash pulse vaporization. What that means is that we could vaporize a set volume of the skin without causing an extensive amount of what's called non-specific thermal damage. What this would do is it would allow us to have a more rapid healing. And we purchased a laser from, at that time, Johnson & Johnson called an Ambulase, which was called a super pulse laser that basically pulsed out within a few hundred milliseconds an amount of energy to vaporize tissue. But the laser just wasn't powerful enough. So we worked with a company called Coherent Medical, who had developed a very powerful 240-watt laser to vaporize tissue, mostly in the endometrium or the intra-abdominal through a fiber that the OBGYNs were using for endometrial surgery. And we asked if they would instead put that laser not on a fiber, but an articulated arm where we could use it on the surface of the skin. And they were able to use the parameters, which we wanted the basically a 5 joules per centimeter square amount of energy within a millisecond in order to perform a flash vaporization of the skin so that we would have very little non-specific thermal damage. And we were able to do this on the lip. And so instead of a 4-week healing time, it was basically a 1-week healing time. Now, one of the things that we noticed that is in addition to getting rid of the precancers or cancers on the lip, it appeared that the wrinkles around the lip also became smoother. And so we tried this laser on one of our very elderly patients in her 90s who had a large squamous cell carcinoma on the forehead. And instead of doing Mohs surgery with a huge graft or advancement flap, we decided to use this laser to vaporize off this superficial squamous cell cancer. Much to our surprise, not only did the cancer go away, and it didn't come back within the lifetime of that patient, but the wrinkles on her forehead also went away. We then used this same laser to treat an epidermal linear nevus on a 9-year-old boy that extended from the lateral aspect of the cheek all the way down the neck to the clavicle. And in the past, this was a procedure that you needed to actually surgically excise this lesion which would leave you with a fairly noticeable scar. So we treated this linear epidermal nevus with the laser, and again, much to our astonishment, we were able to get an incredible result with zero scarring. So we then said, okay, what about patients that have a lot of vertical wrinkles on the upper lip? And so we use this laser again to treat just the upper lip wrinkling, similar to what we would do in the old days, which was using chemical peel. And again, much to our surprise, the wrinkles were significantly improved without any adverse effects. So we went back to the Coherent Medical Company. We told them about what we were doing, and we had one of their chief engineers, Dr. Dale Koop, design not only an articulated arm for using this laser, but a scanner, which could scan at a variety of different densities to allow us to treat not only a single area with the 3 mm spot size, but the entire face. And this started the procedure called laser resurfacing.
Thank you for listening to the Origins Podcast. We encourage you to reach out to the editor of the Dermatology Digest and share your stories.